Welcome to the HIV and AIDS Care series. The series is broken up into 4 sections. We've covered Section 1, the Evaluation and Management Codes. Series 1A, which we are covering now, is Pathology and Laboratory. The next slide covers your disclaimers. Your learning objectives are here on slide number 4. First objective is to explain the importance of proper documentation in patient health records, to identify and explain CPT codes, to identify and explain the various codes necessary to report HIV pre-testing, HIV counseling without pre-testing, HIV post-test negative counseling, and HIV post-test positive counseling. The last objective is to identify and explain commonly used modifiers. This slide just provides you an overview of all of the acronyms used in the presentation. So let's begin with HIV Test Documentation. The first visit regarding the documentation comprises of the signed HIV consent form, the notation of the test results communicated to the patient, as well as your HIV test results. Your second visit consists of written justification for the rationale for the second or any subsequent HIV test visits. For example, risk identified during the first visit requiring further counseling. So now let's just go back to your first visit so that I can clarify. By first visit, I mean the first visit once it has been established that the patient has an HIV positive result. HIV pre-test counseling without testing, the documentation should include written justification that counseling was provided, the reason why the patient declined testing, and any follow-up care plan, including indications for further counseling and testing if necessary. So in this particular type of visit, the documentation is specific to a patient that comes in for pre-test, HIV pre-test without any testing, where the focus is just on the counseling component. HIV counseling documentation for a patient that has a positive result. I apologize. The documentation should include preliminary or your confirmatory positive test results, referrals for medical care and supportive services, follow-up to confirm continuum of care. So that entails any of the additional services or care pertinent to the patient's treatment plan, preventative or risk reduction counseling, including follow-up care, partner counseling and assistance, including domestic violence, and also the medical provider HIV or AIDS report and partner contact form. All of this information should be documented in the health record. As far as your annual assessments, the annual assessment documentation consists of prevention and risk reduction counseling and a follow-up care plan. It should also include partner counseling and assistance that also includes domestic violence screening if necessary. Regarding your documentation, while various state Medicaid agencies suggest the use of the rapid HIV test, it is truly up to the provider's discretion whether they want to use the rapid HIV screen or whether they want to use the conventional HIV screen test. Contact your local Medicaid agency for specific guidance for both testing types. Just some additional information regarding documentation. It is not necessary in all states to have the signed HIV consent form in the medical record, documented in the medical record. So you have to contact your local Medicaid agency for specific guidance. For example, in New York, you don't have to document, you do have to document verbal informed consent, but this may vary in other states. So again, to reiterate, you want to contact your local Medicaid agency for specific guidance with regards to how HIV counseling, testing, the consent form, and any of those components should be documented, whether it's verbal is satisfactory or whether you need it actually in written format. Also, another important point about the pre-testing. Some states do not cover pre-testing, so you have to follow up with your local Medicaid agency to find out what the reimbursement requirements are for HIV pre-testing. It may be worthwhile when a patient comes in for an annual exam to just perform the components of an annual exam and document that HIV pre-test counseling was performed. And if you bill for the preventive visit annual exam, along with the HIV pre-test counseling, the annual exam is a reimbursable service. The annual exam code was covered in Series 1. So to further explore types of CPT codes that are utilized to bill for services in an HIV and AIDS care setting, we'll look at the pathology and laboratory section of the CPT codes. To reiterate what was covered in Series 1, the CPT code set was developed by the AMA in 1966. All of the codes in the CPT code book are updated annually and available on January 1 of every year. The CPT codes describe the procedures and services that are performed to treat medical conditions and to diagnose medical conditions in the case of the pathology and laboratory section codes. And typically the path lab codes are reported on physician claims in an outpatient clinic or outpatient hospital or physician's office setting. HCPCS. The acronym HCPCS stands for Healthcare Common Procedure Coding System. It is another code set that is commonly used to describe procedures and services. The HCPCS codes were developed by CMS, the Centers for Medicare and Medicaid Services, in 1983. HCPCS codes are also updated annually and available January 1st of every year. HCPCS codes describe certain procedures and services that are used as a supplement to or in place of the CPT codes. Approximately 80% of the HCPCS codes cross-map to CPT codes. So you should contact your local Medicaid agency for specific guidance to find out whether you should be using HCPCS codes or whether you should be using CPT codes. The first set of codes that we're going to discuss in the pathology and laboratory section that pertains to HIV testing are your HIV antibody codes. So if you notice, in this section, you'll see a combination of CPT codes as well as a HCPCS code. So for the first type of code, CPT 86701, this code is used to report the HIV-1 single result. The HCPCS code G0435 is used to report the HIV-1 and HIV-2 single result test. So depending upon your local Medicaid state agency would determine which code or codes you would use to report the HIV antibody. The rapid HIV test codes are G0435, 86701, 86702, and 86703. And these codes are used for the two tests that are listed here by the manufacturers, OraSure Technology and Trinity Biotech Unigold. Typically, the Medicaid state agencies cover one test every 6 months. So again, you have to check with your local Medicaid state agency to find out which test you can report and what codes you should be using to report the test. An additional service that may be used to report services, your HIV test screening, is the venipuncture code. Venipuncture is a blood sample or urine sample collection, and the code for the venipuncture is 36415. Typically, it may be necessary when an HIV blood screening is performed. It may be necessary to report, in addition to one of the antibody codes, CPT code 36415 if it's a blood screening. A continuation of your HIV test codes are your HIV antigen codes. And so this is a long list of all of the antigen HIV test codes that are available to report. So you have your CPT 87389, your HCPCS G0432, your CPT code 87390, 87391, HCPCS G0433. And the list goes on down to CPT code 87539. You have to contact your local Medicaid agency to find out which codes should be reported for the HIV antigen, because some payers, some Medicaid agencies require reporting the CPT codes, and some may require that you utilize your HCPCS codes, HCPCS G0432 or HCPCS G0433. It's also important to discuss modifiers in this segment as well, because anytime you're reporting procedures and services that are performed together during an encounter or during a visit, it may be necessary to utilize a modifier. So for the purposes of this segue, modifiers are 2-digit numeric or alphanumeric codes that indicate that a procedure or service has been altered by a specific circumstance, but has not changed the code's definition. There are some CPT modifiers and there are some HCPCS modifiers. In the case of the reporting of modifiers, some modifiers may impact reimbursement. So it's important to find out what modifiers impact your reimbursement and when it's appropriate to utilize them. Modifiers are never reported alone, so you should not be reporting any services with just a modifier. You should be utilizing a CPT code or a HCPCS code, and when necessary, append a modifier. Modifiers are never reported on ICD-9 codes, which are covered in Series 2, so we'll discuss ICD-9, the diagnoses in Series 2. For further information regarding the appropriate use of any modifiers, contact your local Medicaid agency for specific guidance. The commonly used modifier in this segment would be Modifier 92, which is an alternative laboratory platform testing. And then here's just some information regarding the explanation of what Modifier 92 is. This modifier is only reported on CPT codes, and I gave some examples of the CPT codes in parentheses. These modifiers, or I'm sorry, I should say this modifier is never reported on the E&M codes, which were covered in Series 1. This modifier is never used on HCPCS codes. The HCPCS codes are the codes that begin with the alpha G, as in George. And for further guidance on the appropriate use of this modifier, you should contact your local Medicaid agency for specific guidance. The second modifier that's used on your Path Lab HIV test screening codes is Modifier QW, Clear Wave Test. And so again, here's just some information on what a clear wave test is. The Modifier QW is only reported on past lab test codes. And here in parentheses, I provide the codes that you can report Modifier QW with. Do not report on any other code type. So here again in parentheses, your codes that are appropriate with Modifier QW are the codes that are the only codes that you can utilize or pin Modifier QW to. It's important to note that if a combination of a waived and a non-waived test is performed on a patient, that you should not utilize the Modifier QW. So if you're only performing the waived test, then you use the Modifier QW. If you're only performing the non-waived test, then you do not need the Modifier QW. If you're performing a combination of both waived and non-waived, then you have to utilize them. I'm sorry, you should not be using the Modifier QW at all. To find out which CPT or HCPCS codes are appropriate with Modifier QW, contact your local Medicaid agency for specific guidance. So let's look at some examples. The first case study is a 27-year-old patient that presents for primary care, recently concerned about having unprotected sex and also requesting an HIV test. Since the physician noted in the chart that the patient did not have a well visit, we explored the well visit codes in Series 1. So in this series, we'll only be looking at the HIV screen or the HIV test code. So in this instance, the physician performed the HIV test. According to this example, it says that this is a rapid HIV test that was performed. And the code for the rapid HIV test in this example is 86701. And the modifier 92 or the modifier QW, depending upon the local Medicaid agency's specific guidance, would be appended to this code. Because if you look at this example says that the patient also had a well visit. We will look at some specific examples in Series 3 that shows the two code sets reported together so that you can get a clear insight into how you should be reporting these services when a patient comes in for more than one service together on the same day. So here's the rationale for this HIV pre-test with preventive care. So this is an established patient that presented for an HIV test. The CPT code 86701 was reported based on specific coding guidance from the local Medicaid agency. But let's go back to slide number 9. Slide 11, where you'll see the HIV single result 86701. The additional information that, because this was an additional service that was performed on the same day, it is necessary to report a modifier 92 or QW, which should only be appended to the HIV test code. So you would contact your local Medicaid agency for specific guidance as to whether or not it is appropriate to report modifier 92 or modifier QW. The second example is an HIV pre-test without preventive care. And so again, the codes are the same, so we're not going to spend too much time looking at this example. The rationale is the same, so we're not going to spend too much time with this example. But just to be clear, the code is the same, and depending upon your local Medicaid state agency will determine which modifier you'd be utilizing for this particular HIV pre-test. So some coding tips, because those are the only two examples that are provided in this series. HIV pre-test with testing and preventative care, including counseling, where we're only focusing on the HIV test code. So again, just let's go back and look at the test codes. It's dependent upon the local Medicaid agency that will determine which test code you're using. So if you're going to be doing an antibody, you would report the antibody codes. And if the HIV test is a blood screen, you would also report CPT code 36415. If it's an antigen, then you would select the appropriate antigen code based on the service that your local Medicaid state agency says is appropriate. So if your local Medicaid state agency gives you guidance to utilize CPT codes, then you would select the appropriate CPT code for the service in question. Or if your local agency says to utilize HCPCS codes, then you would utilize HCPCS G0432 or G0433 for your HIV antigen screening tests. So let's go back. HIV counseling without testing, where there is no preventative care. And so again, you would utilize the same set of codes, your HIV antibody codes or your HIV antigen codes. So let's just go back real quick to that slide. So your antigen codes or your antibody codes, depending upon the guidance from your local Medicaid agency. Some coding tips that should be helpful in making the decision on which test code to select. CPT code 87389 includes 86703, which is the code for HIV-1 and HIV-2 combined. And it also includes 87535, 87536, and 87390. So in those scenarios where the patient has an HIV-1 and an HIV-2 combo test, or they have the HIV-1 antigen test, it is only necessary to report CPT code 87389, because this particular CPT code takes into account all of those services in a combo, as a combo code. So you should not be reporting all of these codes in combination with one another. You just report CPT 87389. You want specific guidance, contact your local Medicaid agency, because in some states, the Medicaid agency may prefer that you report 86703 instead of 87389. Or they may prefer that you report all three of these codes, 87535, 87536, and 87390 instead of 87389. The last couple of slides just provide you some additional resources that you can refer to for some additional coding tips and additional information to further guide you in selecting the correct code. So you have your web resources, you have the American Academy of Professional Coders and the American Health Information Management Association, which are two key web resources that can be utilized by coders. The last two resources that are commonly used when coding are the CPT coding book as well as the HCPCS coding book.